Did you know that even though ribosomes are so small, they can cause a major deformity in a person? Well, lately, scientists have found some ribosome diseases that have changed the way people function today. Ribosomes play a vital role in a cell because they synthesize protein chains. A ribosome assembles the 20 specific amino acid molecules to form the particular protein molecule. This protein molecule is determined by the nucleotide sequence of an RNA molecule. A ribosome is made up of two subunits, a large one called 60S and a small subunit called 40S. These two subunits help make the protein chains. Ribosomes can be found in the ER or floating around the cell. But ribosomes can also take a turn for the worst and cause a problem in the way a cell functions, and even in the way the overall organism functions. A good example would be how ribosomes are the cause of a dysfunction called Diamond-Blackfan anemia, or DBA for short. DBA occurs when ribosomal protein 19 cannot produce ribosomes, so this ribosomal protein plays a vital role in the production of ribosomes, so the loss of function of this gene causes a major malfunction. For the prognosis of DBA, many cases go into remission spontaneously. Survival into adulthood can be expected in many cases. The first treatment of DBA is to give the patient steroid medication. About 70% of patients with Diamond-Blackfan anemia respond to this treatment, in which the medication stimulates the production of more red blood cells, which the bone marrow cannot produce. If a patient doesn't respond to steroid medication or needs too much, the treatment becomes blood transfusions. The only actual cure for DBA is bone marrow transplantation, but this is a difficult procedure, and it doesn't always work. Diamond-Blackfan anemia is usually diagnosed with the first 2 years of life, and sometimes at birth. The diagnosis of DBA might not be recognized right away, because the disorder is rare and not all physicians are familiar with it. A bone marrow sample or a biopsy would show that few red blood cells were being created because of the malfunction in the ribosomes. Symptoms of Diamond-Blackfan anemia include physical defects such as hand deformities or heart defects. Symptoms can vary from mild to severe and life-threatening. Since DBA causes a lack of red blood cells, and red blood cells carry oxygen through the body, people with DBA might have symptoms related to not enough blood oxygen. DBA occurs when ribosomal protein 19 has a mutation and fails to make bone marrow, which causes a halt in the production of red blood cells. This scientific investigation proves that ribosomes have a big impact on how a person or organism functions.